Atherosclerosis, the silent threat to your arteries. Atherosclerosis represents a pervasive and often unnoticed health challenge, earning its designation as a silent threat due to its insidious progression. This condition typically develops over many years, frequently beginning as early as childhood and gradually worsening over time without presenting any discernible symptoms. This prolonged asymptomatic phase means that individuals often remain unaware of its presence until a critical health event, such as a heart attack or stroke, suddenly manifests. The absence of early warning signs makes the disease particularly dangerous, as significant arterial damage may have already occurred by the time symptoms become apparent. This inherent characteristic underscores the critical importance of proactive health management and early detection efforts. At its core, atherosclerosis involves the accumulation of a sticky substance known as plaque within the inner walls of the arteries. Arteries are vital blood vessels responsible for transporting oxygen-rich blood from the heart to every organ and tissue throughout the body. As this plaque builds up, it causes the arteries to narrow and harden, severely impeding the flow of blood to essential organs and tissues. The widespread impact of this condition is profound, as diseases linked to atherosclerosis stand as a leading cause of disability and mortality globally. Notably, coronary artery disease, CAD, a common form of heart disease directly resulting from atherosclerosis, is recognized as the most prevalent heart condition in the United States. The process of atherosclerosis initiates with damage or injury to the delicate inner lining of an artery. This initial damage can stem from various factors, including persistently high blood pressure, elevated cholesterol levels, the damaging effects of smoking, or the metabolic disruptions associated with diabetes. Once this inner lining is compromised, the body's natural healing response inadvertently contributes to the problem. Blood cells and other substances, including fats, cholesterol, and calcium, begin to collect at the site of injury. This accumulation gradually forms deposits known as plaque. Over time, this plaque undergoes a hardening process, causing the arterial walls to become thick and stiff, a condition colloquially referred to as hardening of the arteries. The presence of inflammation, whether from an unknown origin or linked to systemic conditions like arthritis, lupus, psoriasis, or inflammatory bowel disease, also plays a role in initiating this arterial damage, with markers like C-reactive protein indicating its involvement. This underlying inflammatory component highlights a deeper biological trigger for the disease, suggesting that managing systemic inflammation could be a vital, albeit less frequently discussed, aspect of prevention. As plaque continues to build up, it progressively narrows the arteries, constricting the pathway for blood flow. This reduction in arterial diameter significantly diminishes the supply of oxygen-rich blood to the various tissues and organs that depend on that particular artery. The long-term nature of this buildup, potentially starting in childhood, creates a precarious situation. While the plaque may remain stable for years, a sudden rupture can occur. If a plaque ruptures, it can trigger the rapid formation of a blood clot. This clot can then either further reduce blood flow or completely obstruct the artery, leading to acute, life-threatening events such as a heart attack or stroke. The gradual, chronic progression with the potential for sudden, catastrophic events means the disease acts like a slow-ticking mechanism, where a seemingly benign condition can abruptly turn into an emergency. The development of atherosclerosis is influenced by a complex interplay of factors, many of which are within an individual's control, offering significant opportunities for prevention and management. Prominent among these modifiable risk factors is high blood pressure, which exerts damaging force on artery walls over time. Unhealthy cholesterol levels, specifically elevated levels of low-density lipoprotein, LDL, often termed bad cholesterol, and triglycerides, coupled with insufficient levels of high-density lipoprotein, HDL, or good cholesterol, are major contributors to the formation of arterial plaque. Smoking and the use of other tobacco products inflict substantial harm on arteries. making them more susceptible to fatty deposits and accelerating the growth of plaque. Diabetes and insulin resistance also significantly heighten the risk by adversely affecting blood sugar regulation and contributing to arterial damage. Beyond these primary factors, an unhealthy diet characterized by high intake of saturated and trans fats, added sugars, and sodium directly contributes to elevated cholesterol, blood pressure, and unhealthy weight gain. A sedentary lifestyle, marked by a lack of physical activity, is a key driver of obesity, high blood pressure, and high cholesterol. Obesity itself stands as a significant risk factor, increasing bad cholesterol levels, blood pressure, and the likelihood of developing diabetes. Other controllable elements include sleep apnea, chronic stress, which can lead to unhealthy coping mechanisms and elevated blood pressure, and excessive alcohol consumption, known to raise blood pressure and triglyceride levels. It is important to recognize that these risk factors are often interconnected. For instance, obesity can directly lead to high blood pressure, high cholesterol, and diabetes. Similarly, insufficient physical activity can contribute to obesity, which in turn exacerbates other cardiovascular risks. This intricate web of interconnected risks means that addressing one factor often yields positive effects across multiple others, highlighting the profound impact of holistic lifestyle adjustments. This pervasive influence of daily choices on arterial health underscores that lifestyle modifications are not merely recommendations, but rather a fundamental prescription for managing and preventing atherosclerosis. While many risk factors can be managed, certain elements remain beyond individual control. These non-modifiable risk factors include aging, as the propensity for arterial hardening naturally increases with advancing age. A family history of early heart disease or stroke also significantly elevates an individual's susceptibility, indicating a genetic predisposition. Furthermore, specific genetic variations can increase the likelihood of developing atherosclerosis. Inflammatory conditions such as lupus, inflammatory bowel disease, or psoriasis can also contribute to arterial damage and heighten the overall risk. In its initial milder stages, atherosclerosis typically presents no noticeable symptoms. The disease progresses gradually, and arteries can become considerably narrowed before any signs of impairment emerge. Symptoms generally only manifest when an artery has become so constricted or blocked that it can no longer deliver an adequate supply of blood, oxygen, and vital nutrients to the specific organs and tissues it serves. This characteristic absence of early indicators reinforces the concept of atherosclerosis as a silent threat, emphasizing the critical importance of regular health screenings and proactive management of risk factors, even in the absence of overt symptoms. The specific symptoms of moderate to severe atherosclerosis vary significantly depending on which arteries are affected, providing important clues about the location of the disease. When atherosclerosis affects the heart arteries, leading to coronary artery disease, individuals may experience chest pain or pressure, commonly known as angina. This discomfort can be described as squeezing, heaviness, or tightness, often triggered by physical activity or intense emotions, and may radiate to the neck, arm, or back. Additionally, shortness of breath and unusual fatigue during routine activities can signal that the heart is not receiving sufficient oxygen-rich blood. If the arteries leading to the brain, carotid arteries, are compromised, symptoms may include sudden numbness or weakness in the arms or legs, difficulty speaking, slurred speech, temporary loss of vision in one eye, or drooping of facial muscles. These are classic indicators of a transient ischemic attack, TIA, often referred to as a mini-stroke, which serves as a critical warning sign that a full stroke may be imminent. The immediate and severe nature of these neurological symptoms demands urgent medical attention, as prompt intervention is crucial to minimize irreversible brain damage. When atherosclerosis impacts the arteries in the arms and legs, resulting in peripheral artery disease, PAD, common manifestations include leg pain during walking, a condition known as claudication. Individuals might also report numbness, weakness, or a sensation of coldness in the affected limb. Should the arteries supplying the kidneys, renal arteries, be affected, atherosclerosis can lead to high blood pressure that is difficult to control or, in severe cases, kidney failure. Fatigue may be a general symptom associated with impaired kidney function. It is imperative to seek medical evaluation if there is any suspicion of atherosclerosis or if any of these symptoms emerge. Timely diagnosis and intervention can halt progression of the condition and prevent severe medical emergencies such as a heart attack or stroke. Immediate emergency medical assistance is warranted for symptoms indicative of a heart attack, including severe chest pain, shortness of breath, cold sweats, nausea, or lightheadedness. Similarly, any signs of a transient ischemic attack or stroke, such as sudden numbness, speech difficulties, vision loss, or facial drooping, require urgent medical attention. If left unaddressed, atherosclerosis can lead to a spectrum of severe and potentially life-threatening complications, extending its impact far beyond the initial site of arterial plaque. This condition is not merely a localized problem, but a systemic disease capable of affecting any artery in the body, initiating a cascade of problems in distant organs. A heart attack occurs when a plaque within a coronary artery ruptures, triggering the formation of a blood clot that completely blocks blood flow to a section of the heart muscle. Without oxygen-rich blood, the affected heart muscle tissue can be damaged or even die. Common symptoms include intense chest pain, shortness of breath, cold sweats, and nausea. When atherosclerosis affects the arteries supplying the brain, particularly the carotid arteries, a blood clot can obstruct blood flow, leading to a stroke. This interruption in blood supply can cause brain damage, manifesting as sudden numbness, weakness, difficulty speaking, or paralysis on one side of the body. The chronic narrowing of arteries and persistent high blood pressure, both direct consequences of atherosclerosis, can gradually weaken or stiffen the heart muscle over time. This impairs the heart's ability to pump sufficient blood to meet the body's demands, culminating in heart failure. Insufficient blood supply to the heart due to narrowed arteries can disrupt its electrical signaling, leading to abnormal or irregular heartbeats. Peripheral artery disease, PAD, arises when atherosclerosis impacts the arteries in the arms or legs. Reduced blood flow to the limbs can cause pain, numbness, and in severe instances lead to tissue death, known as gangrene, which may necessitate amputation. In some cases, the arterial wall, weakened by atherosclerosis, can bulge outwards, forming an aneurysm. While many aneurysms remain asymptomatic, a rupture can cause catastrophic, life-threatening internal bleeding. Atherosclerosis can narrow the arteries that supply blood to the kidneys, depriving them of the oxygen-rich blood necessary for their function. This impairs the kidney's crucial role in filtering waste and fluids from the body, potentially progressing to chronic kidney disease or kidney failure. The range of complications, spanning from acute, immediate threats like heart attack and stroke to chronic progressive conditions such as heart failure, peripheral artery disease, and chronic kidney disease, highlights the dual nature of the danger posed by atherosclerosis. It not only carries an immediate risk of mortality, but also profoundly impacts long-term quality of life and can lead to significant chronic disability. This distinction underscores the importance of both rapid emergency response for acute events and sustained long-term management to mitigate chronic progression. Given the frequently asymptomatic nature of mild atherosclerosis, proactive diagnosis and timely treatment are paramount to prevent the condition from worsening and to avert severe complications. Regular health checkups are therefore essential, particularly for individuals with known risk factors or those within the age range of 2 years. This approach signifies a crucial shift in medical practice, moving from waiting for symptoms to appear to actively screening for the underlying condition or its risk factors before significant damage occurs. This proactive stance is vital for preventing acute crises and aligns with a preventive health philosophy. The diagnostic process typically commences with a comprehensive medical history, during which a healthcare provider will inquire about an individual's risk factors, including family history of heart disease, smoking habits, dietary patterns, physical activity levels, and any existing medical conditions such as high blood pressure, diabetes, or high cholesterol. A physical examination may offer initial clues, revealing signs like abnormal heart sounds, diminished pulses in the limbs, or notable differences in blood pressure between the arms. Various diagnostic methods are then employed to confirm the presence and extent of atherosclerosis. Blood tests are fundamental for assessing key risk factors. They measure levels of various cholesterol types, LDL, HDL, triglycerides, blood sugar, and inflammatory markers such as C-reactive protein, which can indicate inflammation in the body. Imaging and functional tests include an electrocardiogram, ECG or EKG, which records the heart's electrical activity, rate, and rhythm, identifying any abnormalities. An echocardiogram, utilizing sound waves, creates detailed pictures of the heart's valves and chambers, providing an assessment of its pumping efficiency. Doppler ultrasound employs sound waves to measure blood flow through arteries, effectively identifying areas of narrowing, blockages, or the presence of plaque. It is particularly valuable for examining carotid arteries in the neck and blood vessels in the limbs. A specialized carotid ultrasound specifically images the neck arteries to detect hardening or narrowing that could affect blood supply to the brain. The ankle brachial index, ABI, is a non-invasive test that compares blood pressure measurements taken in the ankles and the arms. A significant disparity can indicate narrowed vessels in the limbs, often due to atherosclerosis. During an exercise stress test, the heart's performance is monitored while the individual engages in physical activity, such as walking on a treadmill. Heart problems, which may not be apparent at rest, often become evident when the heart is working harder. Angiography is an invasive procedure that involves injecting a special contrast dye into the arteries and then using X-rays to visualize and pinpoint blockages in arteries of the heart, neck, brain, or other parts of the body. CT scans, computed tomography, provide detailed cross-sectional images of arteries, clearly showing any hardening and narrowing. A coronary calcium scan is a specific type of CT scan that quantifies the amount of calcium in the walls of the heart's arteries, serving as an indicator of plaque burden. MRI, magnetic resonance imaging, is an advanced imaging technique that detects tissue damage or issues with blood flow in the heart or arteries, offering clear, detailed images without the use of X-rays. A cardiac PET scan is a specialized heart scan that can help diagnose disease in the heart's smaller blood vessels. An abdominal ultrasound can visualize the abdominal aorta to detect aneurysms, bulges, or plaque buildup in this major artery. The sheer breadth of diagnostic tests available, encompassing biochemical, electrical, structural, and functional assessments, highlights that no single test is typically sufficient for a comprehensive diagnosis of atherosclerosis. Given its systemic nature and varied manifestations across different arterial beds, a multimodal approach combining various types of assessments is often necessary to obtain a complete and accurate picture of the disease's presence, extent, and impact, thereby ensuring timely and effective intervention. Lifestyle modifications form the cornerstone of both preventing and treating atherosclerosis, often proving to be the sole necessary intervention for some individuals. These comprehensive guidelines empower individuals to take significant control over their arterial health. A heart-healthy diet rich in vegetables, fruits, and whole grains is paramount. It should also include low-fat dairy products, skinless poultry, fish, legumes, non-tropical vegetable oils, and nuts. Crucially, limiting the intake of saturated and trans fats, red and processed meats, added sugars, sugar-sweetened beverages, and sodium is essential. This dietary approach helps to effectively manage cholesterol levels, blood pressure, blood sugar, and maintain a healthy weight. For regular physical activity, aim for at least minutes per week of moderate intensity activities, such as brisk walking, cycling, or swimming. Consistent exercise plays a vital role in lowering blood pressure and cholesterol. aiding in weight management and strengthening the heart muscle. Achieving and maintaining a healthy weight is crucial, primarily through balancing dietary intake with physical activity. Even a modest weight loss of -% of body weight can significantly reduce risk factors like high blood pressure and cholesterol. Quitting smoking is one of the single most impactful actions an individual can take to reduce the risk of atherosclerosis and its complications. Tobacco severely damages arteries and accelerates plaque growth. Avoiding exposure to secondhand smoke is equally important. For stress management, chronic stress can contribute to unhealthy habits and elevate blood pressure. Engaging in relaxation techniques such as yoga, meditation, or dedicating time to friends and family can help mitigate these effects. Ensuring hours of quality sleep each night is fundamental for cardiovascular health, contributing to stress reduction and the stabilization of blood pressure and heart rate. Limiting alcohol consumption is also important, as excessive alcohol intake can raise blood pressure, increase triglyceride levels, and contribute to irregular heartbeats and obesity. When lifestyle changes alone are insufficient to manage the condition, medical interventions become a vital component of treatment, addressing risk factors and alleviating symptoms. Statins are widely prescribed medications that effectively lower levels of LDL, bad cholesterol, which is essential for slowing the progression of atherosclerosis and reducing plaque buildup in the arteries. Antiplatelet agents such as aspirin help to reduce the risk of blood clots by preventing platelets from clumping together, thereby lowering the likelihood of heart attack and stroke. Anticoagulants, blood thinners like warfarin, are used to prevent the formation of harmful blood clots. A variety of blood pressure medications, including beta blockers, ACE inhibitors, and calcium channel blockers, are employed to manage hypertension, a significant risk factor for atherosclerosis, by relaxing blood vessels and reducing strain on the heart. Nitrates are prescribed to alleviate chest pain, angina, by widening the coronary arteries. For individuals with diabetes, specific diabetes medications may be necessary to help control blood sugar or insulin levels, which is crucial for overall cardiovascular health. In severe cases where arterial blockages are significant and cannot be adequately managed through lifestyle changes or medications, surgical or procedural interventions may be required to restore blood flow. Angioplasty and stenting involves inserting a catheter with a balloon into the blocked artery. The balloon is then inflated to open the artery, and a stent, a small mesh tube, is often placed to keep the artery open. Coronary artery bypass grafting, CABG, is a major open-heart surgery where a healthy blood vessel, typically taken from another part of the body, is grafted to bypass a severely blocked coronary artery, thereby improving blood flow to the heart muscle. Endarterectomy is a surgical procedure that involves the removal of plaque from the inner lining of an artery, commonly performed on carotid arteries to prevent strokes. Atherectomy is a minimally invasive procedure that uses a catheter equipped with a specialized cutting device to remove plaque directly from the artery walls. The comprehensive nature of these treatment approaches, which combine lifestyle modifications, medications, and, when necessary, advanced procedures, highlights a synergistic strategy. Lifestyle changes address the underlying causes and modify risk factors, medications manage symptoms and control existing conditions, and procedures provide immediate relief for critical blockages. This integrated approach ensures that each component reinforces the others, leading to improved patient outcomes. Ultimately, the emphasis on lifestyle changes for both preventing and treating atherosclerosis suggests that preventing the onset or progression of the disease through healthy habits represents the most impactful and cost-effective intervention. The extensive, actionable advice on lifestyle underscores that individuals possess considerable power to mitigate their risk, making prevention not just a medical recommendation, but a profound personal responsibility and the ultimate objective of public health initiatives. Atherosclerosis is indeed a silent threat, a condition that progresses gradually and often reveals its presence only after significant arterial damage has occurred. However, A deep understanding of this disease empowers individuals to take decisive control over their health. By recognizing the various risk factors, comprehending the subtle early signs, and committing to proactive health management, individuals can significantly reduce their vulnerability to its severe consequences. The journey toward optimal arterial health begins with informed awareness and consistent action. Regular health checkups are essential, particularly for those with existing risk factors for atherosclerosis. Engaging in open discussions with healthcare professionals is vital. They can accurately assess individual risk profiles, recommend appropriate screenings, and provide tailored guidance on the most effective lifestyle changes. When necessary, they can also prescribe medical treatments that complement these lifestyle efforts. The progressive nature of atherosclerosis, often initiating in childhood and advancing with age, coupled with the necessity for continuous lifestyle management and potential long-term medication, underscores that managing arterial health is not a one-time fix, but a lifelong commitment. Consistent effort and ongoing engagement with healthcare providers are fundamental for achieving long-term cardiovascular wellness, transforming the silent threat into a manageable aspect of a healthy and fulfilling life.